All right, now this morning I wanted to use the controversy in the Tamale Teaching Hospital to have a very open discussion about healthcare in Ghana. So what happened? The health minister and the MP for Tamale North stormed. This is where storm is a useful word. Stormed the hospital, I think 3 days ago, and to have a conversation, basically an unannounced visit to look at the state of emergency care, because there had been many reports of the poor service at particularly the emergency side. And there had been a 31-year-old man who had died, a patient who had died there, which led to a lot of anger. So I believe the minister and the MP went there to check for themselves without announcing their visit, what was going to happen. And the audio clip that we heard, it was a pretty civil, useful conversation until a remark was made by, I think, an official of the hospital to the effect that people were blowing the death of the patient out of proportion. And Sky, you see, for me, I can understand when a duty bearer gets angry over certain things. Okay, so for example, when the fire incident occurred in Edum and the Kumasi, the minister of the Ashanti region got angry. Look, sometimes when you're a duty bearer and people are working with you and you don't see the sense of urgency, it can be annoying. Okay, so remember that he blasted the fire service officer, who then who basically also went to social media to blast him back.
But you and I disagreed on that.
Which, fine. And then now we come to this particular one as well, where they're having a discussion, and you see,
what's the difference?
That's the point. A patient is died, and again, I wasn't there, but the context of what I heard was that a comment was made about the like people are blowing this thing out of proportion. Okay, and the minister's like, no, you can't say that. Somebody has died. People are hurting. Okay, then it became back and forth, back and forth, back and forth. Okay, so there are two sides here. The person who's in charge feels like there must be more empathy, there must be more remorse when a patient loses their life. When you don't have facilities to work with, you still have to give your best of care to the patient. And you don't need to appear callous or unconcerned or basically indifferent.
Why?
That's the one side. Then the side of the person who is the professional is like, you know what? I'm working my socks off. I don't have constant power. Sometimes water doesn't flow. I'm not that well paid. I have colleagues who've left the country. And I'm doing my best. So you can't come here on one visit and come and grandstand with cameras and come and be blasting me in the open. Okay. I'm saying that between the two sides, we need to see both perspectives. If you go to a newsroom of people who are always not doing well, you are supervising a team of journalists, and they're always giving you excuses, you will be angry. Even though, yes, they can say that they don't have all the facilities in the world to work with, that doesn't mean they shouldn't produce certain results. So it depends on where you are. If you are the way you see somebody's supposed incompetence or callousness or mistreatment of their customer as a duty bearer is not the same as the worker who also believes that he's working against all odds to do his best. Okay, so I think both sides may be right, and we need to find some middle ground. But the most important person here is the patient and the family of the patient, who doesn't have a voice. Okay, so we can argue all we want about what the minister did or the hospital did. Hospital has gone on strike. I think it's rich. Minister has come to blast one of your colleagues, therefore you are going on strike. Seriously?
Solidarity.
So you weigh the professional pride against your own professional commitment to saving lives.
Yeah. So
okay, I'm laying out the issues. I'll give you the matter. My point is, fine, you can say solidarity, but Sky, you cannot tell me that having outpatients turn back home, emergency services not being received. The Tamale Road has many accidents. Last week, 10 people died at a place not far from Buipe. 3 of them were missionaries from Jamaica. They were rushed to the hospital. They believed that they were not given the best of treatment. They died. Okay. Now, you cannot call a strike on the basis that one of your colleagues was poorly spoken to by a minister. And therefore, do you know the importance of the Tamale Teaching Hospital to the people of Tamale? Do you know how many people would die because of this strike? Yeah, so we have to balance things. Yes, the minister may have gone overboard in the way he spoke, but do you decide that you will not work because somebody is angry? Is that what you went to learn as a professional? Come on. So let's be balanced. And by the way, you as patients, the treatment, you went to a hospital. You go to hospital everything doesn't work. Meanwhile, they will connect you to a private facility where everything supposedly works, which they have shares in.
Has the government provided everything?
Can the government provide everything? And does that justify why every single thing does not work? You go to lab, you know they work. You go to even the way they even diagnose you. You get it? So you even this week you went to the hospital. What did they tell you? That the thing doesn't work, so go and pay. You want to pay so much money for something that should have been there. So let the hospitals do not make it look like they are so good and that people are just being unfair to them. Last 2 weeks, we got stories in the newspapers about Smith Hospital, Ridge Hospital, that people go and do surgeries. When you go and do the surgery, they will ask you to make all kinds of payments when you even see what you are paying for. Go and read the newspapers. You go to a hospital to do a surgery, you are desperate. You are paying so much money. Then they'll say, go to some lab in Osu or Cantonment and pay for some gadget. You won't see the gadget you pay for. They give you a private receipt. Then you go and do the surgery. They don't even give you the equipment back. And hospitals are overseeing this rot. And then we shouldn't talk. Go to UGMC. People become comfortable and callous because they know that when people are sick, they are desperate. You go to private facilities in Osu. 100, you go to do tests, go to that place, they will give you nice treatment. Go to Kolebu, go to 37, see how they will treat you. Well, if you're a minister, what will you do? Fine, you can't change the system in a day, but you also have to show that you are committed. How else do you show that this has to stop?
So the minister's role is to rage bait and to generate public outrage, not to solve the problem. But what does we are outraged.
No, but in the chat you had, were they angry from the beginning?
No.
It degenerated.
I gave you 15
minutes. It degenerated.
But I gave you 15 minutes.
I thought you were asking me a question. I'm answering you.
No, I gave you
it degenerated.
Hold on for me. Bernard, what was the purpose of the minister's visit?
Fact-finding.
To fact-find.
Yeah.
With the member of parliament of
Tamale North. Tamale
area.
North, yes.
Was there to fact-find.
Yes.
On something that they had heard.
Yes.
Other than that particular issue, had the minister heard other reports about the hospital? He did same for Ridge, right?
He went to Ridge last week. Jude was there. They did a full report, and he promised that Iyoko will investigate.
Okay. So, in this particular instance, his visit was on the basis of the complaints that had come.
I believe so.
Why did he need to have that conversation with the person who runs the hospital?
Who runs that facility? Not the full hospital.
Who runs that facility with a camera in their faces?
Journalists follow ministers everywhere they go.
No. So the minister could not have gone to the man's office and said, we have heard ABCD. This and this and this.
Mm-hmm.
You understand?
Yeah.
The motivation and the look of it was that you had come to create a scene.
But when you heard the audio yesterday, did it seem like they were creating a scene?
No.
I played the audio yesterday.
Bernard, when I am coming to seek answers from you on something
Yeah.
I've heard, I will not come with a horde of cameras behind me to come and ask you, hey, what happened here? What is going on? What are the issues? No. I will come and have a conversation with you privately.
It depends.
And say,
it depends. Sky, sometimes we follow.
No,
so sometimes. No, are you asking me? I'm answering you.
No, I'm not asking you.
Then
Rhetorical.
okay, then rhetorical.
For you to answer.
Okay. Then don't look at my face. Because when you look at my face, I will answer
are
you.
not for you to answer. We have seen. I am not a big fan of the generate public outrage and leave work undone system of things. I am all for Akandoh's enthusiasm. You need that kind of enthusiasm for the deep-seated problems we have in the health sector.
Mm-hmm.
The willingness to attack those problems head on.
Mm.
But also must have an understanding of the sector that you work in and the skill set of the persons involved, the limitations of the people involved. So in him going to that hospital facility that day,
mm-hmm.
what was his understanding? What is his briefing? Because one, he's the
Minister
of Health.
Mm-hmm.
There would be a regional director of health.
Mm-hmm.
What has the regional director of health told him about the circumstances at that hospital? what has the regional director of health told him about the conditions that perhaps had led to the sad, tragic passing of this individual that led to the minister feeling that he had to go there with the sitting member of parliament. You understand? So there are a whole number of ways that answers could have been sought without the need for what we saw. You see, because we also don't have to, and my concern is this, and I spoke about this in the first week of the appointment of new ministers. I even addressed it when Shamima was here. There is a lot of show what you are doing on camera with this group of ministers, CEOs who have come in. I don't know why, and it does look like it's a strategy. The public does like to be informed of the work that you are doing, but there's a way to go about this. That is why you have communication experts. That is why you have publicists. They do that kind of work. That is why, as political parties, you would even have a communication department, because political communication is very different on what you want to sell. But in the function of being the supervising head of that sector, showing up with a horde of cameras behind you.
I don't like your adjective horde.
It's a horde.
It's our work. It's our work.
Bernard.
Horde saying.
Bernard.
Horde saying.
Bernard.
How many cameras were there? Are camera people evil people now?
No.
That you are describing us as a horde?
No.
Like locusts?
Horde speaks to intention, it is the minister's intention in this particular circumstance that I am speaking to. His intention was to generate outrage.
But
You
that,
can
has been,
disagree
his,
with
but
me.
that has been a strategy even in opposition.
No.
He's been going to hospitals with camera people
Yes.
before.
But
Even in opposition, he was doing it.
Yes, but I am saying that what you do in opposition to generate outrage does not mean that you do the same thing when you have actual power to solve the problem, because then you work within the confines of something. So, for instance, if I have made my name as a social commentator or a blogger, an independent blogger, I have built my following, and you hire me to come and work at CTFM, you might like some of the nuances of the things I have done to build that following. But once you hire me, there will be conditions as to how I operate, irrespective of the successes I have achieved. You will say that these are the constraints of where you work. This is what you must do. But you still have the free will to do what you do so that we will also benefit. Do you understand what I'm saying?
I'm following.
So, the minister has done something in opposition. Now that he has actual power to solve the problems, he must also understand that he is bound by the strictures of his office. There are processes to be followed, which is why I said, what was the report that he had been given by the regional director? What prevented him from having an adult conversation with...
The fact that you are talking in front of camera means the conversation. I'm saying now listen to the voice we play.
Bernard.
They were having a decent conversation.
Bernard.
It was a decent conversation.
Bernard.
You heard me.
Bernard, you see, what have you... You can say it was a decent conversation.
It was going fairly well.
How did it degenerate?
Because somebody said something which was out of sync.
Exactly.
With
Because, you see, because the minister had a group of people with him.
Yes.
Now, within those group of persons is somebody who felt that there was a need for somebody to be mellowed.
Fair.
We don't know who that individual was, but why did that person need, if the minister had sat down with said person in his office, would that person be there to have a conversation? If that person were there and even this happened, is that how you would talk to the person? So, in all this, we've lost again, and I'm very happy you made mention of the fact that in all this, it's the patient that loses, because we are the most important. But we must also understand that there are limitations to what we can do. There are processes that need to be followed for the work that we do. It is good to shed light on those things that, okay, the public has seen.
So
what is
you think
happening there.
you think it's like some stunt?
No, I'm not saying it's a stunt.
Go there and what's happening?
You see,
is that not part of
hold on.
leadership? That you
No.
have to also set the tone by
No, you
going
see,
to the place of action.
One thing I have learned covering politics in this country is every politician in this country is smart and moves with a strategy.
They don't do anything by heart.
There is no politician in this country, no matter how much you underestimate him or her, who does anything by heart. No matter how misguided it might look, no matter how misguided it might sound, all of them will explain what they do for you. And most of the time, after they are done explaining it to you, you will know that there's rationale to theirs. The rationale might be justified or not. So again, I say showing up with the camera there in that instance to have the conversation there. This was the ER that he showed up in, is it not?
I think the lobby. Yeah, I think so. The oxygen. Where's no oxygen? We have to even get the voice. But Akoto, I get you.
So I am just saying it could have been handled better.
Fair enough. Now you've made a point about the general approach of some of the new leaders where they want to go with cameras and things. Now, two things. Is that not a sign of the times we're in? That right now, a lot of the public are consuming their information directly on social media.
Yes.
Now, you lead people who are young who also want to know what's happening.
Yes.
Now, we use cameras to do a war against indiscipline.
Yes.
Law enforcement does not necessarily have to have in front of cameras, but
Yes.
for a whole season, it was profitable because there's a certain sense in which throwing light on things gets people to sit up.
Yes.
Now, if you inherit a system that is problematic, is challenging, you can do two things. You can, as you say, you can work and chew gum. You can put in place structural things to bring change, but also do some immediate things to say it's not business as usual. Mm-hmm. So for me, I don't have a problem when a minister goes to a place to ascertain directly what happened. Mm-hmm. Fine, you can say that a better way is to say, let your own family go through the same health system. It will give you a more, it will give you a more sober taste of reality. So I can get it when they try and do everything for the cameras. But I'm saying, a lot of people who run these places also need the light to be shown on what they do.
I do not find.
And in shedding that light, I do not think that that conversation was out of place.
Bernard.
It was a decent question and answer session. Fine, something happened, it went off. So I hear you on the point that you can't solve systemic problems with PR stunts. 100%, I cannot disagree with you. Although I know some of these things can be good for the public, that's why you and I are talking about it. It's a good start. You can't solve that problem. My other question though is that at the end of the day, Godfred, look at the reaction of the hospital. I think it's unfortunate. Mm-hmm. It's unfortunate because when the patient died, you didn't go on strike. You could have said, this patient died because we have requested for oxygen for many, many years. We've not gotten it. There's been neglect in Tamale Hospital and therefore we will not work again because our patient don't deserve to die. You didn't go on strike on the so-called concern for the patient over all the things the government has not done. Somebody comes to blast one of your colleagues and you think that going on strike is the best way to resolve it. So you are more interested in your professional pride than your commitment to the health and the life of the people.
No.
And I'm saying that is wrong because if really there is a grievance on the part of the health professionals, it should not be over that 2-minute altercation.
Bernard,
because not even a lot of people even saw that thing.
Bernard,
for it to deserve a whole strike.
No, Bernard, this is a very simple matter, and I like the point you've made. The how many patients died that day in the hospital?
Definitely more than one. But one became emblematic because of the circumstance and the way it happened.
How did the minister come to the determination that that particular death was medical negligence?
We haven't said, yes, we are saying that there was public outrage.
No. The minister...
But the minister hasn't said that... Did you hear the audio?
No.
The minister hasn't blamed the...
So why did the minister go there?
To ascertain what is going on there.
So there's a death at the Dansoman Polyclinic today. Is the minister going there?
No, because the outrage... but you are leading people. Godfred, if you sit here... I don't understand what you're saying. So there's something has happened that has generated outcry.
No.
And as the duty bearer, you have to go.
No, you see...
you should say that, well, we are
likening a duty bearer to a regular person, which is why I disagree with you. You are saying that the duty bearer deserves to behave like I would respond or you would respond. Then why are you a duty bearer? My response to an emergency in City FM should not be Samensis response.
No. If there's an emergency that has led to public outrage,
no matter, you see, Bernard,
so the minister should not go there.
There's a reason why you are better paid than I am. Do you know that?
But that's why.
There's a reason why he's better paid than you.
But that's why some decisions. Wait. Are you saying that the minister's reaction to the outrage ought not to have been going there? It should have been more like a structured response because it's that same structured response, right? Letter memo. The whole thing can become a cover-up.
No, but
the whole thing can become. You see,
the point I'm making.
The whole thing is business as usual.
No, I'm trying to answer your question about the response of the hospital that you feel is not proportional. The
It's
doctors there-
disproportionate.
Yes, hold on for me. And I'm saying that you are getting that response because the doctors there would feel that the minister coming there was an act of bad faith. And hold on, you see?
Why? You shouldn't come there.
No, so I ask you.
Is it a no-go area?
Bernard, hold on. I say, how many people died that day at the hospital?
We don't know.
Exactly. So what accounted for the minister's presence there?
The outrage
Which outrage?
of the people in Tamale about that person's death.
Why?
Because the circumstances were strange. He has to go and find out what happened.
He could not have called the regional director to ask, give me a briefing before I
He
get
probably
there.
did. That doesn't mean he shouldn't ask those questions. The fact that he got a brief doesn't mean he shouldn't go. My point is that Godfred, going there is symbolic
It is
and also
not.
substantive.
It was
you
not-
can have.
It was not useful.
Well, the outcome shows
was
that it
not
probably
useful.
was not.
It was not useful.
It probably was. That's why we are talking about
No,
it today.
it was not
If you
useful.
hadn't gone there, we'll be discussing Galamsey or something
we
else.
will still be discussing because, Bernard, a lot of people have died in hospitals. Public outrage has gone. We have discussed those issues.
Yeah, but
did ministers go there?
Yeah, but so wait, is the hospital why if the minister can the minister go to the hospital to go and check what is the problem with going there?
He can.
So
how many hospitals is he visiting today?
but what did the minister even say that requires a whole strike? What did he even say? Play the audio. What did he even say?
I'm saying, which hospital is
People are
visiting today?
desensitized. People are desensitized to the needs of patients. They've created fiefdoms. They don't care about people's health. They've created private business out of our life. And sometimes you need outrage to start dealing with it because not everything is within your control as a minister. Sometimes when you go and even set up a probe, by the time they do all the things they do, there's a whole cover up. Other institutions are involved. Sometimes you need to go there and let people. The anger of the public is also currency that you can use to bring change to places. A lot of our institutions, people there don't want to work or they want to make money. You even pay to use a toilet. You go to your hospital, you want to you have to pay money. They don't give you receipt.
Yes.
You are telling me that all these things we should just sit down and let it go on because my regional director will tell me what I should do.
I did not say
a lot of people in the chain are compromised. So for me, even the sacking of the CEO, yes, it should have followed due process, and they are saying it was not linked to the.
Do you believe it?
I don't at this point. I don't even care.
Okay.
Because he's overseen this rot for years.
Okay.
And he hasn't done anything about it. So I don't even want to cry for him. The
No
TUC
problem.
can talk for him.
No
My
problem.
point is that
The
if somebody is sent to Tamale Teaching Hospital today, we need better treatment. This morning they should sit up.
Better.
They shouldn't be going on strike. They should be saying that. They should be saying that today we are tired of the bad publicity we have generated. Let's treat our patients better. Let's write a memo to say, in view of these patients, that we demand these things. Give it to media. Call journalists and say we need oxygen. We will report it for you. Media can also be a good tool for exposing poor facilities. So the minister doesn't have exclusive right to media. There are also journalists in Tamale. The hospital could have called and said, for 6 weeks we've asked for oxygen, we've not gotten it. Write a story about it. We'll write it for them. So our presence there should not be. Don't they use us to cover their programs? So why should when we follow the minister there's a problem? Why can't we discuss your work in the public? Why shouldn't the public know that sometimes your callous nature lets people die? What is wrong with that? So you go on strike because you have the luxury to go on strike and you still be paid. You are there to save. Do you know how many poor people will die today because of a strike over somebody's anger? Why we all get angry yesterday? Blasted me in a meeting. Does that mean I won't come to work?
But nobody saw a camera there.
There are people there, but I'm here.
Let's be prepared to admit
that
you see.
Let's not do this.
Have a crisis
let's not do
situation. There's a way to deal with it. The question you ask yourself is whether the path the minister chose, right, albeit to ascertain what may well be going on there, produce the result he wanted at the end of the day. Because when he saw the situation escalating, and so-called, choboy boys were behind. We are one minister, kasa. That was where the thing didn't.
They didn't say that.
I mean, sort of. You listen to the voice closely.
They didn't say that.
No, I want us to find a delicate balance.
I'm working with you.
As an employer, there are specific responsibilities imposed by the Labour Act on you, the employer, to create the kind of environment that will make it possible for the employee to deliver his responsibilities.
And as a worker, there are specific responsibilities enjoined on you to deliver service to your customer. Also,
exactly. That's
you haven't done that.
Hold on, Bernard. What I'm trying to say.
Let's all come together. we are not debating one another on this. Okay, it's beginning to sound like Bernard is on one side, Godfred is on one side.
Media,
They are no. They are
we are
not.
all for the patient.
They are all saying the same things. I think there are just little variances in this one. Okay, maybe how the minister conducted himself, why he went there, whether he has achieved it. Okay, now these questions are legitimate questions. They don't actually nullify the points that Bernard is also making. This is the point I just want to put it in context.
Exactly.
That is not you versus me kind of conversation. Because frankly, there are deeper issues that confront the hospital for which the hospital staff or the community of doctors should be very angry with. Now, whether they have done that, we don't know here. I mean, whether in the past they have registered their frustration, whichever way, we don't know, and we can't.
No, but there have been statements issued in the past by the medical association complaining.
These are
talking
genuine.
about
We are talking about specific
We're talking
situations.
about
Tamale
I'm
matter.
not saying they haven't done that. I'm only saying
don't even
that
hear
let's give them the benefit of the doubt that they probably may have done it and gotten to the point where, look, we've done whatever we can. Okay. Now, is it also true that there are people who have been given the responsibility of managing our state hospital facilities who refer people to their private facilities?
It happens.
And mess up the state, so I'm just saying that it's a mix of a lot of things. But the question that Godfred is asking, so the minister chose this angle. Now, minister should understand that the guy there is an MPP appointee, and there have been rumor about they want to remove him.
You mean the director?
Yes, the one who's been moved. Okay.
Yeah.
Now, if there's suspicion between yourself and the minister, I can understand why the minister would take this approach. Now, and I'm not even condemning the minister. I'm only explaining that, look, the minister went there because he knew what he was expecting to find. That's why he went with media. He knew. He didn't go there to have a meeting to check what was going on. It was to catch him. That finally I've caught you. These are the cameras. That's my thinking. Okay, he could have attended to this situation with a better approach. But I'm not condemning how he did it. Question is, did he achieve his objective?
We'll answer that question when we come back from the break.
That is
It's
the
4 minutes past 8. And I think some message is useful because even though it's like we are exchanging heated words, we all agree that the customer, the Ghanaian patient,
It's important.
is at the
Heart of
is
it.
bearing the brunt of bad governance, political, and also administrative healthcare delivery at the public service. So both people are not doing well for the Ghanaian patient in terms of investing, supervision of the facility, and making sure that the right outcomes. The poor patient is bearing the brunt of all of those things. So I'm not here to take somebody's side to say it's right or wrong, but sometimes you need to break the cycle for people to sit up again, which is my reason for supporting the action. All right, so here are some reactions to the Tamale Teaching Hospital controversy.
Okay, so good morning, team. We have failed to take responsibility. Also because there are no consequences for our actions. With or without cameras, duty bearers must demand for accountability. Thank you. Bernard, I agree 100% with Godfred. The intention translated into the approach and it was totally wrong. The minister didn't appear to gather information to help solve the problem at the hospital. He was rather advising the staff solely based on what he heard from family members. The minister was saying they didn't counsel the family members, but the doctor explained they did, and it's even part of protocol. The style of questioning and public nature all appeared they were there to accuse the staff of wrongdoing. Watch the videos again, Bernard. Good morning, team.
Morning.
The public health sector is very technical. The minister's posture and some of his utterances show that he does not understand some of the technicalities of the sector. He has technical advisors. If he had consulted them, I am not sure this would have been the outcome. He should let them guide him. And Mr. Avle, you are being very unfair in your analysis. Talk to your daddy medics and get a clearer picture. This is from Kwame.
I have my own experience.
Yes, okay.
And I'm coming from my own perspective, which is why Godfred also has his different views.
Yeah.
So I can't always agree with you.
Jonathan from Gawe says, a point of correction, please. Teaching hospitals report to the Minister of Health through the teaching hospital boards. They are not under the Ghana Health Service to be supervised by the Regional Director of Health Service or be briefed by the Regional Director of Health Service, a purely Ghana Health Service administrative structure. The distinction between teaching hospitals and the Ghana Health Service is clear. But honestly, I think the minister could have done better. I sincerely think the plan was rife to remove the CEO So whatever he did was to implement the plan. Bernard and team, Godfred's argument is flawed because this is not the first time the minister has visited a hospital unannounced. Is Godfred saying that cameras should be prevented in those scenarios? Watch the videos and you will see that the minister was listening to the doctor attentively until things broke down. Good morning, CBS.
Morning.
The minister mentioned faulty life-saving equipment that hadn't worked for 5 years. The CEOs are doing nothing about it because most times they have the same equipment in their private hospitals that they refer patients to. This is an open secret to all. With the rage issue, the one who is to fix the problem is a friend. I don't want to say things, Charlie. Let's give management of hospitals to professional administrators to manage. Let medical doctors focus on their jobs. That's all. Jimmy Jack from Dansoman. Jimmy Jack, good morning. Courage from Kofodia says there's nothing wrong with the minister going around with the camera. If you were doing the right thing, you'd not be bothered. The whole situation is just another chapter in the book of political disappointment. More chaos, less progress. A CEO is replaced within 24 hours, yet the core issues remain untouched. They claim the previous CEO failed to address key problems. So why wasn't the focus on actually fixing those issues the very next day? Where's the urgency for real change? If we are serious about change, then it has to go beyond reshuffling leadership. There needs to be a consistent demand for action, transparency, and follow through. Otherwise, we'll just keep circling back to square one. Arrested development in sequel, copy from Adenta. Strategy in opposition should be different from strategy when you are the leader to bring the change. Why is Godfred simplifying the motive of the minister's visit to generating public outrage? Really, Godfred, will this be the first time we see a public officer doing a public unannounced visit? Did you see President Mills's outrage at the customs office? Yao from Sun City. But at the team, the minister's action was wrong. How can a hospital that is supposed to cater for the whole northern region have only, for the whole northern Ghana, have only 4 intensive care unit beds? So if a patient comes in and the beds are occupied by other patients, what do you expect a doctor who has no role in management and policy to do? The politicians should work on the hospital infrastructure before they demand accountability from clinicians. How do you expect healthcare workers to work under these terrible conditions? Abdul is asking. Akwesi says, in all this, let's ask ourselves, when was the last time Ghanaian doctors went on strike because of conditions of service? We don't remember because they are all leaving the country. Ben, good morning. I am Nanaya from Tuba and I completely disagree with you. In the video regarding the hospital, the minister was performing theatrics. The doctor explained and made him know what the problems are. He clearly stated that the A&E does not have a ventilator, and that was why the patient died. The minister just wanted to shift blame to the doctor and called it negligence. The doctor kept reiterating that it wasn't negligence, but a lack of facilities, and that is where the minister got angry, which was out of proportion. No mortality audit was done. No mortality audit is done that way. Neither is it done in front of cameras. The theatrics and settings backfired. Get them facilities and they'll work. We are tired of influencer governance. Good morning, City CBS team. I see our ministers and mayors are adopting a Donald Trump attitude. They seem to want to disgrace civil servants in public to boost their popularity. I think they must be more civil. You cannot have an audit in public to solve some of these issues. Hi, Bernard and team. TTH is an agency operating directly under the Ministry of Health. Yes, that correction has been made in terms of its reporting lines. Bernard, the hospital is going on strike because of the minister's action? So the hospital will not go on strike when people are dying due to lack of facilities? Godfred has his views, but I can tell you, people in my office are not happy with him asking some of the questions he's asking. It's so unbelievable. Davis from Community 25. Well, Davis, somebody has to do the job. Senanu from Dodoa says, good morning, guys. The decent conversation and the scene created can be done in hiding, and then the minister can act with his part to expose wrongdoing, and results will come. How we will win, this is how we will win, and duty bearers will sit up in the future. This one says, good morning, Bennett. Let me read the last one so that the others can come in. Please, I disagree with Godfred Akoto Boafo. 1, nobody needs cameras to capture events because nowadays people have phones everywhere and they're able to capture the most clandestine meetings. If there are people on the field who report to the main boss, does it mean that the main boss never goes out of his office to the field? The whole incident could have been captured by only voice. Would it have made any difference? The only problem is that the minister and his entourage went a bit far and went a bit overboard and were excessive. However, the other negatives with the happenings at the hospital far outweigh the minister's excesses. Now,
I wanted Susu to read for me the Ghana Medical Association's release in relation to this because it outlines their demands in its
the Tamale.
Sorry. Doctors Association of Tamale Teaching Hospital, DATTH. It's just a 2.5 page release. So if you can, or somebody should read it for me.
Sure, I'll get that.
Yeah.
So, following our press release earlier today, the Doctors Association of the Tamale Teaching Hospital held an emergency General Assembly meeting today at 12 noon. The outcome of the meetings is as below. That with immediate effect, all members of the DATTH have proceeded on an indefinite suspension of all emergency and outpatient services. So, in brackets, general OPD, antenatal clinic, specialist clinic, and pediatrics. Inpatient care shall continue for all our clients currently on admission until they are safely discharged from the hospital. So then now they list a list of demands which I will go through. So first is an unqualified apology from the Minister of Health and the Honorable MP for Tamale North to Dr. Valentine Akulpwa, yes, and all the doctors of the Tamale Teaching Hospital and of the Accident and Emergency Services Department. So they said they will resume the provision of emergency and outpatient services after receive the appropriate apologies. So that's number 2. So number 3, the management of the hospital should ensure the following are available in the short term for us to work effectively: constant flow of water through the taps for clinical work, stable electricity, constant supply of oxygen, provision of consumable items as gloves, gauze, cotton, face masks, cannulae, sutures, syringes, disinfectants,
glucometer strips,
plaster, etc. Constant supply of reagents to ensure continuous availability of essential laboratory tests, 100 continuous vital signs monitoring devices, 4 ventilators for the accident and emergency department, 4 ventilators for the intensive care unit, 2 ventilators for the pediatrics emergency ward, 2 ventilators for the neonatal, 2 ventilators for maternal intensive care unit, 2 transport ventilators, 2 transport incubators for the gynecology department, service and repair of the 1,000-liter autoclave machines at the CSSD. They said in the medium term, an MRI scan machine that does not use helium, a CT scan machine that has an infusion pump, a mammography machine, a fluoroscope machine, a CR machine at the main theater. ABG machines are all intensive care units, 2 mobile X-ray machines. DATTH will continue to engage, so that's the demands done. DATTH will continue to engage management to ensure the aforementioned points in 3 and 4 are available for healthcare delivery. We shall advise ourselves if there is failure to achieve the above within the shortest possible time. That should any of our point 6, that should any of our members feel threatened at any point in the provision of services, they shall immediately remove themselves from such hostile environments for their own safety. Number 7, that all media houses release false and biased reportage of the incidents at TTH accident and emergency during the health minister's visits should render apologies to DATTH on their platforms. DATTH shall not engage these media houses until it's done. So it was signed by DATTH and CC, Minister of Health, Northern Regional Minister, President of the GMA, Chairman of the GMA Northern Division, CEO TTH, all directors TTH, sister branches of labor unions in TTH, and all media houses.
So if we get the full scope now of their demands, apology, a lot of things they need, and also certain long-term things that they want. So I think you were making a point about the 2 sides all fighting for the consumers, at least in terms of here. This release shows us the level of need of the hospital in terms of what is required.
Would this be the first time their needs, the state of their needs, is being communicated to the authorities?
Probably this is the first time it's come out in this way for us.
It couldn't possibly be.
No, it's not.
No, I'm sure they know.
At their last performance review, it was highlighted.
So it's gotten to the point of frustration. Okay. I just don't think their last point was so necessary.
False reportage and that kind of thing.
Media houses who reported and won't talk to you again. That's not the way to deal with media. You know, just even if that's what you want to do, you don't write it. You know,
those who reported
because-
should apologize to them.
Yeah, I mean, if you don't deal with the media, who told you that the media will lose? They will pick the story from another media house and use it.
You are the one who will lose.
Yeah, so that one, please, just go easy on that. And let's make sure that the resources required to make... Look, health delivery within that socialist space is a very, very expensive thing. You know, this... You want everybody to get proper health service. It's a very expensive enterprise the world over. So let's not take this for granted. And look, the essence of the minister's visit, I don't disagree. It's his approach that could have been better. That's my personal opinion. Okay, because he's showing a certain degree of empathy in dealing with the issues. Because and then he thinks that I should approach it from preventing people from doing wrong, which is one way of doing it. But providing the resources is very key, because look, if you don't provide the resources, the situation will just get worse. It's only a matter of time. And it's not just that. No, the association is speaking on behalf of the community. In Accra, if you go to the hospital, say go to Kolebu, you're looking for MRI, and there's no MRI, the next thing you do is to look for a private, you know. You don't find the alternatives in a lot of these places. And so they are compelled to consume what the teaching hospital has to offer. So it's a critical need that the government must put on their speed dial to make sure that. But I just say that it's still not the easiest thing. Look, Bernard, do you know that in the United Kingdom, today as we speak, if you get a referral appointment to the equivalent of the tertiary hospital, the shortest duration that you have to wait is 18 weeks.
Wow.
18
For whatever
weeks.
condition?
Yes.
Then
The
you-
only condition, maybe there may be others that I don't know, but the only condition, significant condition, that one you even have to wait for 2 weeks is cancer.
Wow. 18 weeks for a referral to a tertiary
18
facility.
weeks. So I'm just saying that it's not, we shouldn't joke with it. It's a major issue. You see, so if we are going, we should make sure that the tertiary hospital is in a good place. We should create the enabling environment for doctors to set up private clinics, because they all complement government's effort.
Hold on. Hold on small. You see, the last thing you said, we have to look at it well, because you see, I agree that the private facilities play a role, but sometimes there's also, I consider it a moral hazard, that we believe that we can benefit from the chaos in the public health system. You get it? So it may be in certain people's interest to keep the public health facility so poor, so that they create demand for their private facility.
That's wrongdoing.
So I just wanted to caution that I agree that private facilities are useful. They are very good. They are helping. But in some instances, they use the dragging of feet. We don't have this. We are not ready, to force you to use their private facility, which I think we should look at. That does not absolve government from providing what it has to provide. Okay, so the thing is in, I think, 3 parts. The government has to provide, and on that point, he's right. Going there with cameras doesn't solve the problem in the long term. The long term is the list they've provided. Have you supplied the things? That one is clear.
Today.
I even think a better strategy could have been going there with some of the things to even say, look, we have not come empty-handed. So even though we are coming to do inquiry, here are 3 or 4 equipment that can help in
Tanks
the
of
meantime.
oxygen.
Then we can move the discussion forward. But I want to point out that there is a whole system around deliberate running down of public institutions, so that people are forced to resort to private institutions. And I think the minister needs to probe that too. Of course, he needs to supply the equipment the public facilities need before he moves to that next stage. If the guy doesn't have the reagent, he doesn't have the syringe, you can't even start probing anything. You get it? And there has to be and there was a very interesting point Sarpong Asiedu made. He's saying that in Ghana, public policy towards health may be misguided. Why? we all talk about Agenda 111. Let's build new hospitals. Of course, let's build new hospitals. But he says only 5% of the outpatient diagnosis is done. Let me read the story so that I don't confuse it. He says only 5% of consultation rooms can diagnose patients, yet we build hospitals. Let me read that. It's a very serious claim he made. And he researches, he says only 5% of the country's consultation rooms have the necessary tools to properly diagnose patients, yet governments keep building hospitals without addressing the real problems. He says we should stop the political dishonesty. He pointed out to a powerful and damning document called the Holistic Assessment of Health Programs of Work, part of a broader health harmonization assessment report endorsed by Ghana's Ministry of Health, the Ghana Health Service, the Global Fund, and the World Organization. It's not me saying it. He said it is in the report that was commissioned by the government of Ghana, the Ministry of Health, and the Ghana Health Service, and these groups. So it's an internationally accepted report that is done for all countries that are members of the WHO. It says the report states clearly that, guys, listen, only 5% of Ghana's consultation rooms are equipped well enough to make proper diagnosis. Yet, despite this, successive governments ignore the data and spend millions building hospitals that remain hollow shells of functionality. We jettisoned that report and went into building hospitals, he said, shaking his head. This is what I say, that as health professionals, this is what we should be telling the policymakers and the ultimate spenders, which is the case at the health ministry. If you make these decisions which are at variance with what the health assessment report says, then we would walk away. It's as simple as that. I mean, guys, think about that. If the consulting room doesn't have the equipment to do proper diagnosis, and yet you are building a hospital facility, that we are building hospitals because it's easy to show it politically, it's a problem. Because if this report is to be believed, then it's a major issue.
I mean, there's a spectrum, a range, okay, when you are talking about diagnosis, okay. At the extreme end of it, you have diagnosis that require technical, some complex technical resources to achieve that. And there are the basic ones, okay. And so I although he makes a point, I don't take the full point that until we are able to diagnose maybe 50%, we shouldn't build more. Okay. Now what he's also missing out is that 5% achievement can be can account for about 70% of our common ailments. I don't know if it can account for, because what are the ailments? Dysentery, malaria, flu, and all these things. And if you put all together, they may account for between 60 and 70%.
But the reason I feel like I think his point is that the priority of the health professional should be tailored towards telling government to spend more on the facilities.
I do agree.
Not on the
I'm
building.
Saying that
not on the
you
building.
You can't dismiss building more hospitals because we don't have an over-concentration of hospitals.
No, I get you. But it's not either or. Sometimes if you have 1 million cedis to spend between building 2 hospitals and equipping an existing hospital, you may have to find a way of optimizing.
That's correct.
Okay. So, but I kind of agree with him, because if you put up the structure and the structure is only 5% effective, as against having a structure that's already existing that you can equip to be more effective. Do you get it? Maybe this is what Akandoh's policy should be. He should read a report and decide what the priority of this government will be. I'm just saying that politically, it's easy to show I've put up a building, but whilst the building does that solve the problem? Because what we want is proper health outcomes. But if we leave things to political people alone, where they want funds, as Godfred said, they will put up the hospital for you, eat the hospital. But if the doctor is not in the hospital, if there's no equipment in the hospital, what have you achieved?
So you see, the hospital is not a building. Everything must come together to make it a hospital. You remember we went to Toko? Is it Toko we went to build it? Or is it? Yeah, it's Toko we built the.
No, a Black Horse place.
Yeah, what's the name of it?
So this is it's Mepe.
We went to build the structure. Right?
Yes.
At that point, it was not a hospital.
Yes.
We had built a structure which would have to be fed with equipment and
Yes.
human beings
Yes.
to become what would serve as a hospital. You understand?
Before it. And
Now-
then, yes, go on.
The point I'm trying to make is that the Labor Act, for instance, imposes an obligation on employers and what employees too are supposed to do. What it means is that if you are engaging the person as a medical doctor, as a nurse, and the state owns that hospital, and you have committed to say that, oh, if this medical condition will cost, say, 20,000 Ghana cedis, the state will pay, say, 70% of that. It is the people, the patients who go there, who have to take up the rest of the 30%. Which means that if it costs me, say, 100 Ghana cedis to take an X-ray, right, at, say, 37 Military Hospital, what it means is that ordinarily, I should have paid more for that.
Okay.
But the state is somehow taking up the rest of the
Subsidizing the
cost.
cost
Subsidizing
of
it.
the treatment.
So that over time, if the state is not paying its part, while the patient may be going there continuously and paying what he has to pay because that's what they are charging there, ultimately the machine will run down and there will not be any way of fixing it. That is one side of the problem. So what does the government do? The government will have to take steps to ensure that we are paying our part. How many times have we not heard in this country that the National Health Insurance Scheme is not able to pay people, hospitals, what they are due
Money they
because
delay.
of the challenges there? But there is also the other side to it. Circumstances that arise where, for instance, health professionals themselves become a part of the problem.
Charlie?
Where in some hospitals, equipment bought by the state
Charlie.
get either deliberately broken and then shipped out of that hospital. Before you know it, it is in a different hospital, a private hospital,
Thank
and
you.
they are using it.
Thank you.
There are reports of these things in many parts of the country. So that the state provides in some cases, and the people there, some of them, are taking advantage of the situation. So if you look at it, the two sides are
Yeah.
at equal fault. The government in some cases doesn't provide what it has to provide,
Yeah.
and in some cases, some of our health professionals become the problem. Now, the minister should understand that it is no longer
Let me play.
the case that you are in opposition. Yes, you may have used a certain strategy that worked in opposition. Put the spotlight on what's happening in the hospitals, paint the situation as realistic as possible to the Ghanaian people. And on the basis of that, put the government on pressure, under pressure, so that they will do something about it.
Yep.
If the people are not happy, they vote out the government.
Yeah.
Now you are in charge of the space. First of all, you have a duty and responsibility to preserve the peace of the space so that the people of Ghana can get access to healthcare. And it has to be quality and affordable. Now, you went there with cameras. The situation there just didn't degenerate like that. It started at a certain point. I think he should have noticed that this thing was getting to a certain point.
Yeah.
And he should have contained it at that point. That was not done.
That is if his motive was pure, because according to him, he probably knew this was going to happen that way. According to this man.
You see, so Bernard, if you had heard that
Yeah.
someone died
Yeah.
and the person died under questionable circumstances, if you read the what do you call it? The Ghana Health Service Code of Conduct and Disciplinary Procedures. There are processes laid out
That you must go through.
for dealing with cases like that. If there is indiscipline, negligence, and all of that, there is a committee that has got to be set up to deal with it. This is a sensitive matter. Somebody is dead, and condolences to the family. We feel their loss. You set up a committee. The committee will look into the matter. The sides to the issue will be called to make their presentations, and then doctors would review the situation and come. The experts would review the situation and come to a conclusion. Now, a reasonable doctor, competent in his space, would he have taken the steps that he took in the circumstances leading to the death of this person? If there is culpability, there's a way to address it. Now, where you go to the space, and it will seem that you are trying to do that audit publicly, it creates problems because the doctors were now on the defensive. Because the impression was being created that you are the people who have led to this outcome. You were not sensitive, you didn't do the right things, and the person is dead. How did you come to that conclusion? That is the impression they appear to have gleaned from what the minister did. But then also, I think the hospital too, they also have to understand that, look, you are dealing with human lives. In some cases, when emergency situations arrive, doctors are left with, we don't have the right tools to deal with the situation immediately. But what can we do? Sometimes they try. Sometimes they just don't have the tools to deal with the problem. Sometimes you see them, you think that, they are just standing there not doing anything. The person is that if you don't have the syringes to pump the person with some medication or some what do you call it? Whatever. The person will die. But what we see is that often we say, the doctors, we went there, we saw them, they were just chatting. They didn't. Of course, that happens in some cases. So the way to establish whether the person acted professionally or not is to use the due processes.
Okay.
Investigate, establish that this thing was done right or done wrong, and then take concrete action. I must also say, though, that I think the doctors too ought to have de-escalated the situation. You notice that the minister was moving towards a certain direction, maybe because of what he heard. So he came there with some mindset that, look,
you cool him down.
So you say, Mr. Minister, that's not exactly the case. Can we go away from the camera?
Can we go into caucus?
Conclave and deal with the situation. So that it wouldn't be as though you are trying to bruise the ego of the minister. Because you see, the people behind the minister, you would have heard some you see that kind of situation quickly escalates the situation, and we are all
I want us to hear what the Dr. Atiku, who is the I want us to hear Dr. Richard Selormey, who is the General Secretary of Ghana Medical Association, what he's been saying to Eyewitness News on this. So this is the General Secretary of GMA speaking on the matter yesterday.
Indeed, Ghana Medical Association has taken notice of happenings at the teaching hospital. Regarding the CEO and his dismissal, we as an association note that yes, the government of the day has the power to hire and fire, appoint and dismiss anyone. But we believe that there are due processes that need to be followed, especially when this is being done on the back of allegations of negligence. Negligence is not just merely a word to be put about. Negligence is a legal term that has clear criteria that need to be fulfilled. And the fact that this case has yet to be fully investigated and the so-called negligence well established, we believe that this is not a fair way to go. Of course, if you investigate, go through the processes, and there is a clarity on whether there's negligence or not, and the CEO is being found culpable, among other things, it could be other issues anyway. We believe that that is a fair process, and that then allows probably the person to be heard. We do not dispute maybe the minister's desire to see the system improve, but we believe that the tangent that is being it is taken in terms of how this issue is being carried about may not lead to the desired outcomes. You may sack the CEO, but as it is said in healthcare quality improvement, the systems are designed to produce the results you see. And so you may sack one or two people, it may lead to momentary results, and the public may rejoice over that. But once the underlying and core issues are not addressed, you can bring so many people in. And we've noticed even in Tamale Teaching Hospital, many CEOs have come and go, and the problems still persist. So we believe that maybe a better approach could have been used in this matter. Yes.
Doc, your statement is calling for an unqualified apology from the Minister of Health and then the MP for Tamale North. Exactly how do you want this to be done? Do you want the dismissed CEO to be reinstated?
There were multiple events that occurred in the hospital. And if you watch the various versions of the videos, listen to the longer version of the audio, you would notice that one very young, dedicated senior specialist consultant at that facility, one who actually, if you even watch the video, one of the nurses vouches, uses his own personal resources to purchase water, drugs, and other things for patients in the unit in an attempt to respond and explain the situation, which honestly, in our opinion, should not have been conducted in the media space, because you don't conduct clinical audits or audits of patients' deaths in the media space, because it can easily be misconstrued and exposes the staff to various personal and psychological risks. And the facility itself could be laden with suits for issues that may not actually even be related. And so we felt that how he was treated, shouted at, essentially belittled in public, is not at all the way to go. Health workforce constitute a major force in any policy implementation, in any change management that we want to see in the health sector. And many of our health workers are working under trying conditions, breaking their backs, overworking in many circumstances. Indeed, yes, the minister acknowledged this at the end of his interview and talks about that, yes, they should still do their best. In the particular instance where a person needs to be on the ventilator, the best that he's asking to be done is for the person to be on a ventilator. And if there's no ventilator available, it's not the job of that doctor to purchase that thing. And we believe this has been a persistent issue. And if the MP, who is the MP for the area, is so interested, should be looking at how to equip this place properly and resource them, and not public shaming the doctor and other staff that were involved. Indeed, we believe, and we are not here as an association to shield anyone who does the wrong thing. We believe there are due processes that should be followed. He could have been called to an in-camera session, reprimanded where it is found that they had done any wrong, and the matter properly addressed. As we speak, a doctor who is a senior specialist teaches medical students and does many other duties in the hospital. His life is under threat. People have sent various threatening messages to him. He's been cyber-bullied on various things. For what exactly? And on not an established position that there's been any particular negligence. And so we must be very careful. And that is why we think that how he was treated, he's been asked a question to address. You can allow that to go through. And that conversation should, in the first place, not be in the media space. But once it is there, at least we can interact in a very cordial and respectful manner and still institute the change that we want to see. And that is why we are not very happy. And we think that they deserve an apology. And then the issues that need to be addressed, we are willing to sit down.
Okay.
DMA has actually instituted measures to even attract people, support our colleagues to go to places where there are no doctors and other things. And we are willing to partner and support the minister and the government to achieve these aims, but not in this particular manner.
9:02. So that was Dr. Richard Selormey of the GMA. Now let's hear the MP for Tamale North, who was with the Minister for Health. Of course, Suhuyini is also the Deputy Minister for Roads, but this was his visit as an MP because the hospital happens to be in his constituency. So here is Alhassan Suhuyini's view. So by the way, the interview aired was conducted by Hawa Idrisu, and it was aired on City Prime News in the afternoon. But this interview with Suhuyini was in the evening on Eyewitness News.
I think that it is important that I make a little clarification. The hospital is not in my constituency. It is, however, in Tamale, and Tamale is a cosmopolitan area now, and all the 4 MPs in Tamale are now in the constituency. I mean, in the whole metropolis. And the Tamale Teaching Hospital also happens to be a referral hospital that takes care of the about 5 northern regions of Ghana. So we all have an interest in how the hospital facility is being managed. And that is why perhaps I was lucky to be invited by the Minister of Health, because I was in town when he was paying a surprise visit to the hospital to assess for himself the conditions that the hospital is in now. Selom, just to take you a little back, about a couple of days ago, a gentleman passed at the hospital, leading to social media campaigns by people in the community asking for the government to fix the hospital, because the death of the gentleman is not an isolated incident, and people have complained about various challenges with the facility. And I think that is what prompted the minister to pay the surprise visit to the hospital. But the dismissal of the CEO, my understanding is that it had nothing directly related to the death of this gentleman, because after the interaction with health professionals at the hospital yesterday, the minister had a management meeting with the hospital staff, and then later announced a 3-member committee that is supposed to go into the cause of the death of 31-year-old Salim. And so not until the 3-member committee submits its report, I don't think that any action taken from now on until that happens is related to the death. But it is just part of government's agenda to reset that hospital and to respond to the calls of the people to fix the TTH, the Tamale Teaching Hospital, to become, the facility that it is expected to be, to save lives and to improve healthcare of the people. I have followed media reports, and they seem to be confusing what happened with the minister's surprise visit and the dismissal of the CEO of the hospital. I think the two are not, directly related. The minister, I do know, have been in consultation with His Excellency the President, in consultation with opinion leaders and stakeholders in the region, and have been, discussing ways to improve the facility. And one of the ways, in his view, especially after his visit yesterday, where he saw some level of deterioration that he queried the management over, decided that the retooling of the facility may have to start with the removal of the CEO and the subsequent formation of a board for the hospital, and probably some more shakeups at the hospital. I also realized that he took notice of some of the challenges that the health professionals face, especially when it comes to lack of the equipment that they need to do their work. And as far as I'm aware, the whole of today, the minister has been working to ensure that some ventilators are procured and, sent to the teaching hospital, because it came up strongly during interaction with the health professionals that at the emergency unit, especially at the red zone, they do not have enough ventilators. So I also know that after the management meeting, he spoke with his colleague Minister for Energy. He also reached out to his colleague Minister for Water Resources and Water Works and Water Resources, because the issue of reliable, water supply to the hospital came up strongly. The issue of dedicated power to the hospital also came up strongly. So these are some of the things that came up. But the dismissal of the CEO, once again, I want to reiterate, had nothing to do directly with the death of 31-year-old Salman. A 3-member committee has been set up to look into that matter. And the CEO of the hospital, again, is not the gentleman who was seen in the video having exchanges with the minister. The gentleman seen in the video having exchanges with the minister is, we are told, a very hard-working staff of the teaching hospital who makes a lot of sacrifices and is a dedicated worker of the hospital. But he was simply cautioned by myself and the minister not to suggest that the loss of the life of Salim was being blown out of proportion, because we thought that was insensitive.
I see. So the point you're making is that whether or not the minister had gone to the place yesterday, the chief executive was going to be relieved of his position.
I believe so, because I do know that extensive consultations had taken place long before the minister decided to pay the surprise visit to the hospital yesterday.
But you can't fault the persons you say on social media who are misrepresenting the facts because of the timing of the termination of the appointment. I mean, all of this happened, some confrontation between the minister and the doctor at the hospital. By evening time, then the chief executive officer is gone. So though you say that there were consultation or discussions on the appointment of a new chief executive, with the president already, the timing of the events actually made it appear like it happened because of the happenings of yesterday.
I agree with that misconception, and I do not intend to fault anybody. I only would encourage that that should be left with people who perhaps are not sophisticated, but those of us in the public space, in the media, in the policy space, in the medical space, who care about these things, should sometimes, go beyond the headlines and get the facts before we take certain stance and positions. I do appreciate that the circumstances can lead to misrepresentations and misreportage. But the facts remain that the gentleman seen in the video in the exchanges with myself and the minister has not, been taken to any disciplinary measure. He's not the CEO, and I do not think he will be taken to any disciplinary measure. It was just advice strongly offered to him, which he strongly rejected, which we have no problem with. The CEO would have been, I'm sure, dismissed with or without the surprise visit of the Minister of Health, because I know about the consultations that took place before his visit. I think that his visit only afforded him the opportunity to, come to the conclusion that the decision had to be urgently taken. And he decided to do so because of the deterioration of the hospital. I mean, there are facilities at the hospital that have been broken down for the last 5 to 6 years without any, attention given it. In fact, some of the equipment were locked up in hospitals. It took minutes, sometimes hours, for them to even find a key to those rooms to open for us to see. And all of that did not show, top-notch management of the facility, and I'm sure that is what just pushed the minister to urgently take the decision that he took yesterday. But it had nothing to do with the death of 31-year-old Salman. It had nothing to do with the altercation that happened at the hospital. And the altercation did not even include the CEO. The CEO was an observer of what happened. The CEO cautioned his staff, the Dr. Valentine, in this case, to stop talking and stop defending his position. He wouldn't budge. And the minister did same, I did same, he wouldn't budge. We walked away. We do not think that he did anything wrong. We just thought that he perhaps should have been more receptive of the suggestion that we were offering him not to refer to the matter as being.
Alhassan Suhuyini, 12 minutes past 9. Let's read a few more messages as we wrap up. Now, I think the emphasis for us is the hospitals need to be equipped.
Yes.
And if there's any benefit in this controversy, it has been the fact that the hospital has been able to articulate what it needs in very clear terms, what Susu read. So we will have to ask the Ministry of Health what their plan is for equipping the hospital. Because this is the largest referral facility in the northern sector. Yeah. It caters for Upper East, Upper West, Savannah, Northern, and which other one? Yeah. And then the Savannah region. So clearly the needs are very real. A few suggestions have come through that I just wanted to read for progress of the discussion beyond the blame game. Yeah. This is coming from a man who's been in the health sector for long. I don't know if I should mention him. He says, Bernard, here are my takeaways. 1, the minister's decision to sack the CEO without due process was excessive. Now, it was the president who sacked the CEO, not the minister.
But the minister would have advised.
All right. So, correct.
There would have been some
Number
discussion.
2, workers at Tamale Teaching generally are alone to themselves. This is somebody in the medical profession. This is what he's saying. I'm not the one saying it. 3, lack of basic equipment is all over the public hospitals. 4, doctors need to be more accountable there in this particular instance. I personally know people who lost their lives there for very avoidable reasons. That's 5. 6, equipment at Tamale Teaching Hospital ran down, and there's a whole business by the actors there to provide same in the private sector.
It's all over.
But it's particularly, and let me use their own word, it's endemic there in that place. 6 or 7, there's a leadership crisis at many of the public hospitals today. Let me read the 6 conclusions. This is somebody who's in the health sector. Minister's decision was excessive in sacking the CEO. Workers at the hospital are alone to themselves. All public hospitals lack basic equipment. Doctors need to be more proactive in Tamale particularly. He knows people who lost their lives for avoidable reasons in Tamale. Equipment at Tamale ran down, and there's the whole business by the actors there to provide same in the private sector. There's a leadership crisis at many hospitals today, public hospitals. Let me read another one, another long one, but I think it helps the discussion. Good morning, Bernard. Concerning what Samen said about UK hospitals appointments here in Italy, waiting times for appointments varies depending on several factors, including the type of medical specialty, the urgency of the case, and the region in which the hospital is located. In general, non-urgent appointments might take anywhere from a few weeks to several months. For example, a routine specialist appointment could take between 30 to 90 days, while urgent cases are usually prioritized and you can be seen within days. And then there's a couple more. My take on reforms. 1. Medical doctors should not be made medical or district directors. Qualified and well-experienced administrators should be employed for that purpose. 2. Nurses who have practiced for 10 years and above should earn same salary as doctors who have practiced for 7 years and above. 3. Any medical doctor or health professional who refuses posting to areas where their services are needed should not be allowed to practice in any public facility. 4. Government should retool and tool all health facilities from the CHIPS compounds to the teaching hospitals with every equipment and machinery for efficient health delivery. 5. Nurses and doctors should benefit from car loans. 6. State housing companies should build duty post accommodation for nurses and doctors wherever there's a health facility. 7. No doctor should be permitted to manage a private hospital within the jurisdiction government has assigned him to. Can I repeat that one?
Yeah.
No doctor should be permitted to manage a private hospital within the jurisdiction government has assigned him or her to.
Yeah,
8.
correct.
Government should have a pool of...
But that point we may gloss over it. They don't necessarily have to go and manage a private hospital.
agents.
They can be agents, and which some of them are agents of private hospitals. They do referral to look. They can even, some of them outrageously can refer you to a dental hospital even when you are pregnant because the contract. No, that's an extreme. But that's what I'm trying to say, that we see go to this hospital.
Yeah.
We see go to this hospital.
Yeah.
Because the relationship is there.
That's a problem.
And you see, I think,
let me finish the 9.
Yeah, just to make a
take a
quick
point.
You see, the conflict of interest rules still apply. But the difficulty we have enforcing that is we don't have many doctors.
So
Yeah.
you are,
So they are doing locum,
demand,
and you know they have to now use that as a way, and they are abusing it.
Yeah, right.
And it's an issue that we have to clearly.
So let me read point 7 again. No doctor should be permitted to manage a private hospital within the jurisdiction given government has assigned him or her. 8. Government should have a pool of specialists who will be bonded never to go on strike irrespective of who calls the strike. We can also have an MOU with the Cuban Medical Brigade to be on standby anytime the GMA declares a strike. The Cubans are flown in to fill the void. The number of days the doctors are on strike, their salaries, allowances are paid to teams who take over. 9. When the strike is called off, they get 3 months suspension with a bond of good behavior before taking back their roles. This is difficult to implement. You have to work within the labor laws. Your suggestions are controversial. Any loss of life must be investigated. And if this is a result of negligence, the doctor or nurse who was responsible should be suspended for a month. I want a comment on how you can have an independent investigation of a cause of death, because it's
let
very...
me tell
deal
you
with that
something.
before I finish the last
Let
two.
me tell you about the guidelines, the regulations or the code of conduct and disciplinary procedures. This is the 2018 updated one. I'm not so sure if there's a new one which has been updated. Basically, it makes it clear that the purpose of the document is for the attainment of the object of the GS and requires good leadership and corporate governance, as well as disciplined and dedicated employees. The conduct and attitudes of all employees of the service should conform to appropriate norms and standards of behavior which are contained in, and it lists the documents that are relevant. Now, if you go further in there, paragraph 1.3, the scope, it says the code of conduct or the code is applicable to the following personnel: all GHS employees. B, personnel on contract or secondment to the GHS. C, personnel of the GHS on leave of absence with or without pay. And D, any other persons working with the Ghana Health Service under approved terms.
All right.
Now, definition of discipline and indiscipline. Discipline in this context refers to orderly behavior of employees in the service, and adherence to existing rules and regulations.
All right.
Any act of omission or commission contrary to the above definition constitutes indiscipline.
All right.
So it's been clearly laid out.
Okay.
Now, there are guiding principles as to what their mission is. So, for instance, the following guideline or guiding principles are core values, and they form the basis of this document: delivering quality health service in a humane and equitable manner within the resources of the country.
Okay.
Upholding the dignity and interests of patients or clients at all times. Upholding the dignity and welfare of all staff and service providers. It goes on to list some other things.
All right.
Now, if you go further into the document, then there are responsibilities imposed
By on the hospital
or
or the professional.
Yeah, that's right. Employees of the service shall be accountable to the Republic of Ghana, be accountable to the public, accountable to their immediate supervisors, conduct themselves at all times officially and privately in a manner not to bring the image of the service, what you were talking about, into disrepute, and to gain the respect of the service, colleagues, and members of the general public. Maintain political neutrality. And it goes on to list other things. And then where you get into misconduct, you get that in under what do you call it, paragraph 4.1, where misconduct and definition is there, and what constitutes misconduct.
I would have loved you to
listed.
deal with public conflict of interest too when we come back on that. Let me take a short break. This is the City Breakfast Show. We're using the Tamale Teaching Hospital issue to discuss generally quality of healthcare provision. I understand there's a press conference going on, or what's happening at the Ghana Health.
So the ministry this morning.
The Ministry of Health.
Yes, this morning, as part of efforts to respond swiftly to the medical needs of the TTH, Tamale Teaching Hospital, following the recent unfortunate incident, will be donating essential medical equipment to the facility.
Correct.
So that's happening this morning at the Ministry of Health.
Very good. I think you suggested that's what they should have done. Let's read a few final comments as we wrap up this segment.
So this one says that most of the MRI machines at the various hospitals are not functioning. They haven't been functioning for months, and some even years, including that of the 37 military hospital. This person claims we have to take our mom out to a private setup. We have to take our mom to a private setup to undertake these tests and bring results back to the hospitals. It's alleged that most of these machines belong to the practitioners, hence no urgency to repair them. Listening to the MP, I'm more disappointed in the health minister. I thought the death happened on the same day he went to the hospital, not knowing it had happened way before his arrival. He still chose to audit a mortality in public with the media around. Bernard, I wish you can go and stay at the emergency of any public hospital for a day to see how hospital workers break their back and empty their wallets to save patients. Akwesi from La. Bernard, if our public officials use our public health facilities like Tamale and Teaching Hospital, there'll be no need for a surprise visit to know the true state of affairs. If the public hospitals are no good for politicians, why should they be fit for we, the citizens? Kujo from Adenta. Bernard, you've spoken my mind. Godfred, what do you really want to say? Should the minister be an armchair minister? I don't really know what you want to say. The doctors didn't whistle blow when they didn't have the logistics to work with. Are you just arguing because you want the conversation to go on, or you have genuine concerns? Meshach from Chama says, I totally disagree with Godfred. Lots of things have been swept under the carpet for too long, so the minister going there was not to create a public show. The minister did not start firing immediately. Good morning, Flora from Legon, also on my case. Says, Godfred, this morning you are going very wayward. I don't understand your submission. The media and camera was necessary. Necessary. Bernard, your submission is on point. Good job. Please, nurses and doctors don't need a job if they go on strike. The minister and hospital should recruit new people ASAP. The new people you are recruiting, they all belong to the same union. No? It's not like they are coming from somewhere. They all belong to the same union.
Things are deep, systemic.
Bernard, honestly, it was unfortunate for that particular doctor because he's one of the best and even uses some of his personal resources. Even though his later statement about blowing someone's death out of proportion was in bad taste, and perhaps that is why it ended the way it did. The visit was valid because the rot is too much, especially from the cleaners and nurses, and not so much to the doctors. But the doctors are in charge and spend more than 70% of their time on the person on their personal hospitals than at the teaching hospital. They also refer most patients to their private facilities when the teaching hospital can handle those issues. Good morning, Bernard. Please tell Godfred that if the minister didn't go to the hospital, Cameron and journalists, mobile phones would have brought us the news anyway.
Okay, so let's end this by asking, what are the key next steps? From one, do you guys believe the minister should apologize so that people come back to work?
I'll leave that to his sense of judgment. But what I believe, I just want to provide information that, this week, the Parliamentary Select Committee on Health is actually visiting every regional hospital and teaching hospital this week.
Okay.
So they started on Tuesday. They have 3 teams going around all the regional hospitals and teaching hospitals. So I'm sure the problems of these hospitals would have been highlighted to the Parliamentary Select Committee this week as they make their rounds. Their visits will end tomorrow for them to attach a certain level of urgency to some of the needs of these hospitals and the workers who work there, as well as the concerns of the general public about just the environment and perhaps the perceived lack of proper care that they receive at some of these facilities. But again, whether he should apologize or not, I'll leave it to him.
So that's point number one.
His good sense.
In terms of equipment, is there need for a general sort of reaction to this, or just Tamale?
No, Bernard, I think we've done more than enough stories as a station over the past decade to make a case for why we need to equip our hospitals better. We've spoken several times about, and the person who sent you that message about, the point made by our friend at the CDD.
Yes.
What's in his name?
Yes, Dr. Yeah, I know who you're talking about.
If you look at the needs of hospitals in this country, and the fact that we just spent 4 billion.
Sarpong, Asiedu.
We just spent 4 billion to try and build hospitals that we might never complete and never put health professionals in, whilst the existing ones can barely breathe. It just tells you where our priorities have always been. Okay, so it's about realigning the resources that we have to make sure our regional hospitals, our teaching hospitals are well run. And the final point for me on maintaining accountability, I made this point about when we're talking about police, for instance. I don't know how hospital boards function, and how some of these boards function in terms of, oversight. But they need to find ways of getting the regular Joes on some of these boards. You see, because when some of these incidents happen, they being on the board, they are not there for their medical expertise, but they are there for public confidence. Okay, so hospitals and all police, all these public-facing organizations need to get regular Joes on the boards that deal with accountability.
Okay.
So that when something comes out, the regular Joe's point is also heard, and they tell us that, okay, this is what it is.
Okay, so those are some recommendations. Any more before we wrap this up? I have a couple of interviews coming through. Just a final.
I think the logical thing is to invest more in resource in our hospitals, which is a financial decision, a funding problem which we need to deal with. But you see, the funding element is a one-off intervention. But what I think we should go beyond, again, it may be far-fetched, but our TVET, institutionalizing our TVET focus in our education and bridging that technicianship gap in managing the hospital equipment.
Okay.
Because the rate at which equipment break down in this country, I think it's a record.
It's serious.
And most of them, when they break down, it takes a cycle of between 6 months and 1 year before somebody...
Sometimes you have to bring somebody from China to come and fix it.
Somebody from another country. We have institutions here.
Yeah.
So why don't we now target this technicianship thing so that we can... Because as for the buying, every political party, when they come into power, they will do some buying.
So that's not the long-term solution.
The long-term solution, how do we manage it so that we, because look, power switching up, light off, on and off. You think the MRI machines won't be destroyed?
Yeah.
And look, go to Kolebu, look at the lifts. Kolebu lifts.
We fit car inside there.
Yes, because the power on and off is. I'm just saying that it's a bigger problem. But the minister, I think I like his energy.
It's enthusiasm.
I like his
Should
energy.
channel it in
and
the right
everything.
way.
But he will grow up. He will grow in the. He will grow in the work.
He's a great guy.
You know,
I mean,
if he surrounds himself with proper
right
people,
people.
he will grow up. But
Yeah.
if you surround yourself with party people who will clap for you whether you do wrong or
That's the problem.
right.
I think the public image has to be managed
Better.
properly going forward.
Yeah.
Fair enough.
Because he's a great guy. He has easily one of the biggest. He runs easily one of the biggest farms you have in the north of the country, and it's
north?
in the northern part of the country. Yes, yes.
Oh, I
Right
thought
now.
he was.
He's from the
Western North.
Western North, no. But in terms of his farm,
He's a farmer.
Yeah, so he's a great guy. He's a great manager in his own right.
Lovely.
But in terms of how he manages that public image, that's where the difficulty is. I don't believe that he went there with bad intentions, but it produced a result that is not the very
Alright.
best. They should find a way of resolving that.
But they've replaced the director.
Yes.
The
Yeah, the DG, MD.
That's called
See.
24-hour economy.